Well, welcome everyone. As we prepare for our return to in-person services, I know that there are a range of thoughts and questions that many people have as churches prepare to gather again in one place. And some of you may be wondering if it's safe to meet again, and others may be wondering if all these precautions that we've been talking about are even necessary. And so I thought it would be good to help us understand how we are approaching these resumption of services. That it would be good to have a discussion with one of our elders who is also a medical doctor, Tim Burrell. And so he's joining us to kind of discuss some of the whys behind these things that we're doing. And so welcome, Dr. Burrell. Tim, we'll just refer to you as Tim from here on out. So I'm just going to toss a few questions Tim's way here, and he'll guide us through some of these things. So first off, Tim, what have we learned about the virus? Just some context here for a moment. What have we learned about the virus in the last couple of months that is guiding our approach right now as a church as we plan to reopen?
Well, obviously, there's been a lot going on, and every day seems to bring new information. And along those lines, one thing I would recommend is to be selective with your news sources. And the two that I follow the most closely are the CDC website and also the Indiana State Department of Health. So if you have any questions, or if you see something on social media you're not sure about, that's where I would check. Initially, when the virus was first starting to be identified, it was felt that the contact was the most serious mode of transmission, and in reality, it ends up being that person-to-person contact, especially with contaminated air, so to speak, is the most common mode, which kind of makes sense if you think in the flu or even colds. We knew that before, and that seems to be confirmed. A couple other things that have been I think notable changes is that we have been testing a lot for the virus, and at first it seemed like it was everywhere and even our bodies couldn't get rid of it. And what they found is that our tests were really sensitive to identifying viral material, even though the virus may not be alive anymore. So in reality, when we first heard that people might have had trouble or that they were actually being reinfected, and in some instances it looked like they were being reinfected many times, in reality, it was just sort of leftover viral particles. So to me, that was reassuring.
You know, I've heard you in meetings. Elders have been discussing all of this for a while and kind of keeping up to date and tracking and planning. In those meetings, I've heard you point out that we're going to be dealing with this virus for a while, and the news reports seem to bear that out as well. And so that we need to learn to manage the risks. Can you speak to that for a moment? What that means, managing those risks in the long term?
Sure. So it's sort of a good news, bad news situation. And the good news is that 80% of people who catch the virus have essentially mild, moderate symptoms, if any at all. The individuals that don't have symptoms tend to have a very low viral count, if you will. The bad news is that short of a very effective and safe vaccine, it'll probably be a couple of years before enough people have had it that it's not causing high levels of disease. And not that most of us were around back then, but in the 1918 pandemic, it took 2.5 years to work its way through the population. And so my point in sharing that is that while I don't anticipate we'll be in lockdown um, for 2 to 2.5 years, I also don't think we should let our guard down.
As Boris Johnson says, stay alert.
Yeah.
Bad joke, sorry. But that is a sense that, and that leads into this, the things that we're hearing that we just kind of have to kind of get used to, the idea of some sense of physical distance along the way, especially in maybe strange environments or close quarters and things like that. Which I think leads us, one of the things about churches that are unique is that we are indoors. This is one of those things where we do kind of want to be close to each other. That's kind of one of the things of coming together, is to be able to get close, contact, shake hands, those type of things. So while we're trying to keep some physical distance in this, we may still inadvertently or unavoidably walk past someone within that distance. What should we keep in mind about those instances?
As I mentioned, transmission happens from person to person, and what determines that is how close you are and for how long, and any exposure to aerosol or droplets, mostly coming from coughing or sneezing. So those are the three main items. So if people who are symptomatic, first of all, isolate themselves or do not come in contact with other people, that reduces the risk. Second, wearing masks helps any individual who may be coughing or sneezing to reduce the amount of aerosol that they produce. And then just walking by someone briefly, even though let's say it's a narrow space or something like that, will not produce an exposure that's considered to be meaningful or significant. And so from that standpoint, it's not like we're radioactive. It's just that you want to decrease the amount of time and increase the distance to the degree possible.
Okay. Now you mentioned masks there. So what about that? There's a lot of debate. Should we wear them? Are they helpful or not? What can you tell us about that?
Well, once again, it's good news, bad news. Wearing a mask won't protect you from the disease, but it's certainly a courtesy for those who are around us, especially somebody who may be at higher risk, and that is usually somebody who is more elderly or who has some chronic illness. Maybe they have a history of cancer or treatment for that. Maybe they have a history of diabetes or heart disease. And so at the very least, it should be done as a courtesy to those around us and those we love.
It's kind of easy, and I think you alluded to it a little bit. We kind of get this feeling that the virus is lurking everywhere, and everybody is potentially someone carrying it. Is that realistic? Is there a balanced approach that we can take just for our own mental health, that we're not frightened of other people every time we gather or get near anybody?
Absolutely, and there it's mostly good news. These viruses, they don't have little arms and little legs, so they can't move on their own. The virus is very susceptible to just soap and water, so even routine cleaning is generally sufficient. Certainly, hand washing helps. The covering a sneeze or a cough is important, but most spaces, after they've been empty for a reasonable amount of time, and I would say even a few hours, are fine. The areas that are high touch, so door handles and such, should either be cleaned regularly or, when possible, have the door propped open thank goodness the weather's starting to improve, and we'll be able to do that.
Just to kind of wrap this up a little bit, essentially the key elements for us to remember about returning to in-person services is that, we need to enter and exit with minimum contact. Walking by people briefly is not problematic, but staying close and having in-depth conversation, we need to be very cautious about that. We need to respect that 6-foot distance that they keep telling us to do. And we should, avoid those prolonged conversations, or have those maybe outside where air moves away from us a little bit more. Is there anything you want to add to that or expound on?
Yeah, I think at the end of the day, it's important to use good judgment. As I mentioned, if you aren't feeling well, or if you have any symptoms such as runny nose, cough, fever, and so forth, you really need to stay home. And if you're high risk, meaning more elderly or have other medical conditions, you not only are encouraged, but certainly have our permission to stay home and not expose yourself. There are medications that are being developed, and you may see that in the news, but that's more of a Band-Aid. Short of a vaccine, we just need to be more cautious for the foreseeable future, realizing it won't be forever.
It's good stuff. As one of the spiritual leaders in our church, I think it's good to hear that message when you have the permission. Sometimes we kind of grown up, many people, you have to be there if you can be there. And the can may be, I'm still alive and I'm breathing, so I can be there. That it's really, almost a good spiritual practice. If you're in that risk group, or if you're symptomatic, it really is okay to stay home and worship online with us, rather than put yourself and other people at risk.
It's the safest for everyone involved.
Yeah, it's good. Well, hey, I sure appreciate your time, and we're looking forward to when we can all be back together. But I appreciate your knowledgeable insight to help guide us through this time.
Sure thing, and I'll see you Sunday.
All right, take care.
Bye.